Welcome to tonight's webinar, the first in the Live Fully, Live Well series, Attending to Your Health with Patricia Kennedy. My name is Maureen Martin, and I'm a Programs Manager for CAN-DO Multiple Sclerosis. Live Fully, Live Well is a wellness program for people with MS and their support partners. Managing your health and wellness is an integral part of living well with MS. Live Fully, Live Well is a comprehensive program from CAN-DO MS and the National MS Society designed for people with MS and their support partners. Live Fully, Live Well covers topics affecting the whole family living with MS in order to strengthen relationships, increase understanding, and promote improved health and quality of life for the person with MS and their support partner. This program helps people living with MS and their support partners move from education to action. There are 3 aspects to this program: 6 one-day in-person programs around the country, 7 web-based videos introducing wellness topics, and 14 webinars covering the 7 topics from those videos. And this is what you're participating in tonight. All 3 of these programs can be integrated together or enjoyed separately to provide you with the resources, knowledge, and tools to create a personalized wellness plan. This program is made possible by MS Active Source, which is sponsored by Biogen, IDEC, and Elan Pharmaceuticals. As I mentioned before, Live Fully, Live Well is a collaborative program between CAN-DO MS and the National MS Society. The vision of the National MS Society is a world free of MS. The society helps people affected by MS by funding cutting-edge research, driving change through advocacy, facilitating professional education, and providing programs and services that help people with MS and their families move their lives forward. A little bit about CAN-DO Multiple Sclerosis. CAN-DO MS is an innovative provider of lifestyle empowerment programs for people with MS and their support partners. We are the start of a whole new way of thinking about and living with MS. CAN-DO MS empowers people to move beyond their MS by giving them the knowledge, skills, tools, and confidence to adopt healthy lifestyle behaviors, actively co-manage their disease, and live their best lives. A few housekeeping items before we get started. Pat will address questions at the end of the presentation, and we encourage questions and comments throughout. So to ask a question, you type your question in the chat feature, which is located on the left side of your computer screen. So to submit a question, you type in the small box that says chat. Also, many of you submitted questions when you registered, and Pat will address those in her presentation tonight. This presentation is being recorded and will be archived on CAN-DO MS's website. You can view this presentation again or check out the other Live Fully, Live Well archived webinars. For those of you who are attending live tonight, you will receive an email tomorrow with copies of this PowerPoint presentation. So we have a great speaker lined up for tonight, Patricia Kennedy. Pat has been working in the field of MS since 1987. For most of her MS career, she's been providing patient care. Pat serves on the board and is president-elect of the International Organization of MS Nurses. In addition, she serves as a clinical consultant for the National MS Society and is a member of the Client Education Committee. She is active in the consortium of MS centers and is on the editorial board of the International Journal of MS Care. In addition, Pat is the nurse educator for CAN-DO MS. So before we hand it over to Pat, I just put a survey up on the screen. We're just asking for you to tell us about yourself. Are you a person living with MS? Are you a support partner? Are you a healthcare professional or other? So we'll give it just a couple of seconds for everyone to be able to submit their answers. All right, about 94% is a person living with MS. A little over 8% is a support partner, almost 3% a healthcare professional, and about 5% is other. That's a great group for tonight's presentation. And with that, I will turn it over to Pat.
Well, good evening, everyone. I hope you're having a great summer's day and that you're going to enjoy tonight's conference. The title of our, I have to get these slides to cooperate here. The title of tonight's conference is Attending to Your Health. And so you know right off the bat that this is not your typical let's talk about MS and talk about medications and that sort of thing. Tonight we're going to talk about what the rest of your life and the rest of your health looks like and what you can do to enhance that for a better quality of life. I have had patients tell me over the years, and I've been in MS for many years, but I've had this said to me so many times. A person will say the affirmation, MS is not the whole of me. And what they're really saying to me is, I have MS, I have this diagnosis, but I'm not going to let it define who I am. And so that's what I would like to kind of present to you now. Many of you probably, most of you probably, at the time of diagnosis may have felt that MS had taken over this body that had previously been you, and it sort of became who you were, because it's such an overwhelming concept when you are first diagnosed. And, over time, you may have dug yourself out of that and realized that no, life is going on and I can manage this and I am going to get through. But then there may have been an exacerbation at some point and things got worse again. And you may have felt again, oh my gosh, MS has taken over and it is going to take me over. So this is something that people kind of go in and out of, but hoping that as time goes on, there's less in and more out. Some people have not had this same feeling, and that may be because they have a form of MS that is not affecting their lives very much. It could be that they just don't want to face the fact that they have MS and that they're in denial, and so it doesn't become any part of them because it's not something that they can embrace. But for the most part, you can understand this expression and understand how some people, and some of the questions I received prior to this program indicate that some of you are still in that place. MS, while it may not be all of you, the whole of you, it is a disease that affects the central nervous system. And you all are absolutely aware of that. And your central nervous system, if it has damage occurring in it, certainly can affect how you function and how various parts of you function. So it can affect maybe how you move, your movement. It can affect your vision. It can affect the amount of fatigue that you experience. It can certainly give you all kinds of other kinds of symptoms. It can affect your cognition or your thinking skills. So it has that ability in the central nervous system to make those changes. But MS does not affect your overall health. And if you don't attend to the rest of your health, it could be then that your function is going to become more difficult. And that's the whole purpose for this talk tonight, because your whole health and your MS are together. And so we can't separate one from the other. We have to include them together. And if you're going to take care of your MS, you also need to take care of your total health. So caring for yourself is going to improve, hopefully, your quality of life and your ability to live beyond your MS and not be your MS. I sort of look at it as you're shoring up your body and all the systems working within your body to increase your ability to improve the impact that MS has on you. You know, we're not changing the disease, but we certainly can help you to get to a place where the effects of MS in the central nervous system are not going to be impacting your function in general. So that's the whole purpose to what we're going to be talking about tonight. Now, we have to define a couple of words so that we're all on the same playing field as far as the definition goes. And these two words are health and wellness. And I know that you hear those terms bandied about in many different places, and there are wellness centers and there are places for your health and all kinds of things. Well, let's define what that really means. Health is actually, it's pretty dynamic. It's always changing. Over your lifetime, you've probably had the flu, you've had colds, you've had chicken pox, you might have had a broken bone, you could have had a pneumonia, all kinds of things. And you have sort of a baseline, but then you have this illness that intervenes. But what you do is you're able to kind of get over that and function at your optimum potential regardless of your limitations. So even though it took you a while to get over that broken leg, or it took you a while to get over that pneumonia, you were striving that whole time to get back to that level where you were used to functioning in the first place. And we're all able to do that. And wellness, on the other hand, is something that is you have to plan to do it. You have to make a decision to do this. And this is you're wanting to move forward in spite of the fact that you have some sort of an illness underneath. And you want to have, in spite of that illness, you still want to have wellness, and you want to appreciate the joy of living and the things that bring your life purpose and the things that are really important to you. So no matter what the odds are, you want to be the best that you can be, and you want to be grateful for that ability to be the best that you can be. So you want to be able to enjoy your life and always look for ways to bring meaning to your life, and we can do that by using good health behaviors and also by practicing and inserting wellness into your life and how you're thinking about your total health. So if we look at the two words, health and illness, I'm just waiting for this slide to come up here. Health is a continuum. It's like a line across a page. And, it starts at birth and it ends at death. And illness occurs across this continuum. And that illness can be acute or it can be chronic. And so we've already talked about some acute illnesses, and now we're talking about MS can occur, diabetes, hypertension, all kinds of chronic illnesses. People just inherently will strive to return to that health line. It's just something that's within us. Nobody particularly enjoys being ill unless there's some other problem that's going on with them. They don't enjoy that. And so they're going to take on the challenge of getting back to that baseline, to that continuum. And when they achieve that, when they're able to get back to it or close to it or to a level that they find satisfactory, they're going to feel satisfied. And they're going to feel good about themselves because they were able to surmount this. And so at that time, a subjective state of good health can emerge, and life goes on maybe in a slightly different place, but people end up feeling pretty good. Healthcare involves more than treatment of disease. And as I said at the start, this is not a talk about treating MS or the disease of MS. This is a talk about more than that. Let's talk about all the other things that are involved. We certainly want to prevent disability. You can do that. How? You can seek appropriate help. You can be safe. You can be active. There are ways to prevent you from becoming as disabled as you might if you just sort of sat back and said, oh, well, I can't do this. You want to improve functioning, and for that you may need to again see a professional like a physical therapist or an occupational therapist. You may need to make adaptations to what you're doing, how you're doing it, what you want to do. We want to have you relieve pain, and that's pain that comes from the illness, or pain that comes from overuse of muscles, pain that may come from other sources altogether, not having to do with MS. But we want people not to experience pain. We want people to be able to get beyond pain. We would like to address mental health concerns, because when your mental health is a problem, then it becomes a problem for all of you and for your health in general. We want to help people cope with the symptoms of illness, because so many symptoms have ways to manage them that in many ways, if you have symptoms that can be managed, it would be so silly if we didn't make an effort to do some of that management. And we also want to have you improve your quality of life. So now I've thrown in this word quality of life, and what does that mean? Well, it is really a general term. It's an umbrella term, and it means different things to different people, and it means different things in different situations. But it may pertain, quality of life is a general term that is used to describe many factors that are important to a person's life, and that can be physical issues and how a person functions and their physical health. It can mean social issues, how you, what your support group looks like, what your friends and family, what kind of a group that is. Do you have other groups outside of that in which you function? Quality of life also includes your psychological side. Are you psychologically healthy, or are you experiencing depression? Are you experiencing anxiety, any of the psychological or mood issues that can happen? And what is your spiritual life like? Many of us have a spiritual side, and are you utilizing that spiritual strength to help you enhance your quality of life and to move forward with that quality of life? Quality of life also reflects a person's judgment about how well they're living based on a broad array of factors. So, again, this can vary from person to person and situation to situation, but it's broad, and quality of life can be reached. It's just that sometimes we have to work a little harder at it. So now I'm going to introduce another word that probably isn't in your normal daily vocabulary, and that's the term self-efficacy. And what self-efficacy basically means is your belief in your ability to succeed in any situation. So your ability to learn how to do something, your ability to rise above situations, your ability to get a job and succeed at it, your ability to have a family and have them do well. All of those things are self-efficacy, and they're a good feeling when you feel that you have that ability to do all those functions and do well at them. Self-efficacy can also pertain to control over a difficult situation, let's say like a diagnosis of MS. And MS, as we know, there are a lot of things we can't control with MS, but there are some things that we can control and you can control if you're living with MS, and that is how much impact you allow MS to have over you. Self-efficacy also contributes to how people perceive their quality of life. If their glass is always half empty, in other words, I can't ever do that, I won't ever be able to do that, quality of life is diminished. But if the glass is half full, quality of life has a good chance to rise to the top. It's closely related to that degree of support that a person gets from family and friends as well. So a person who lives in isolation isn't as likely to feel, have that self-efficacy. They aren't as likely to have a high quality of life. And if they can get themselves involved and around other people and part of a group larger than themselves, they stand a better chance of doing well in those areas. So what you're going to see now is, excuse me, this has a mind of its own tonight. What you're going to see now is a star. This happens to be the logo for Can Do MS, but it is much more than that. What this is it has 5 points, and we feel, and you probably will agree with me, that in order to be to experience wholeness in your health and totality in your health, you can't approach it in one way only. You have to look at all the various aspects that go into helping you experience fullness in your life and in your health. And that can include certainly intellectual status, and what that means is keeping yourself as up-to-date and as knowledgeable about the things that are going to contribute to your health and wellness as possible. The interpersonal side is how well you interact with others around you, in your loved ones, in your group of friends, in your society, at work, in church, wherever, but how well you interact with people. And as you're dealing with MS, are you withdrawing from all that, or are you in fact embracing those around you? The emotional aspect is so important, because if you have some mood issues and you're not dealing with those, then it's going to make it very difficult for you to do any of the other parts that are going to contribute to your overall health. Certainly paying attention to the physical side of your health is absolutely vital. It's not the whole piece, but it's certainly a big piece. And people can do that in any number of ways, which we will be discussing. And also then there is that spiritual side that I mentioned before. And I think oftentimes that gets kind of left by the wayside because people are so busy thinking about more concrete issues. But if you can take some time and step back and look at that side of your life, you may find some strengths there that you're going to be able to pull upon. And just, I don't know why this is doing this, but we'll go back one again. Remember that looking at that star with all the 5 points, put it into this phrase: an effective human being is a whole that is greater than the sum of its parts. So if any one of those parts is bigger and others are smaller, then you're not going to have that whole human being. And so that's the whole point to what we're discussing tonight. Okay, so let's look outside the box. Looking outside the box means that I want you to, we're not putting MS away, but we're going to see how can you get beyond that MS, and how can you begin to look outside and see what else is out there for you. And the first thing you're going to see is your house. And in that house is a big red rubber ball, and that's MS. And it can feel, especially initially, it can feel just all-consuming. And it's like a big ball in your living room. It takes up the whole space. And you walk in and you try to butt your way around this ball, and you just can't get anywhere because it is taking up so much space and so much time. And you just don't have time to think about any other aspects of your life. But as time goes on, with learning more, with working on your relationships, with taking care of your physical health, etc., that ball begins to get smaller. And you can see it getting smaller there. And you can see it getting smaller here. And then finally, you can see it small enough that it fits into the closet. And when it fits into the closet, you can shut the door. And you'll leave it in there, don't have to think about it, don't have to deal with it quite so much. Now you know it's going to blow up and bounce out again, but then you can shrink it down again and put it back in the closet. And so that's our goal for you, is to be able to step outside that MS and to be able to look outside that box and enjoy what is outside that box. So is your life with MS balanced and healthy in your estimation? Do you feel like you have good balance? Or do you feel as if some of the points on your star may be outsized compared to some others? And this is an example of one way that you can think about it. This is a typical pie chart. And you will see in this pie chart, this is just, what I put together, but there's a piece of the pie that's MS. And then there's a piece that is your attention to your health. There's a personal attention. How much time do you spend on and for yourself? There's your social support system. How much time do you spend with them and developing that? And how much time do you spend engaging in activities outside of MS? So I wonder what your pie looks like. And an exercise that you might use is you might want to envision your pie. So draw your own. Are there areas of your life that need to expand and grow because that little piece of pie is too small? Or are there areas that need to be put into perspective because that piece of the pie is too big? And so kind of that's one way for you to create a visual for yourself, to know where you stand as far as looking at your MS and your place in MS and the impact of MS on you. So how do you take care of yourself? First thing is you need to find a primary care provider. We want you to adopt healthy behaviors. We would like for you to learn how to develop a strong social network. We'd like you to do some things that you want to do, not only the things that you have to do. We'd love for you to be able to learn how to give of yourself to others. We would like for you to give attention to your inner self so you actually can crawl inside that wonderful person you are and see what's in there and give that some time. We'd like you to allow some time for self-reflection. What kinds of things are running through your head? What are you thinking about? What do you need to look at in your life? And we want you to continue to have hope. So in our webcasts that are upcoming that Maureen told you about in the very beginning, we are going to cover these topics, and these are more ways that you can attend to your health. And we'd want you to come in on those webcasts so that you can learn more about these topics. But learn how to manage your fatigue, reap the benefit of exercise, increase your knowledge about nutrition, improve your mobility, which will then allow you to do more, to get outside your house, to get into groups and to get into activities. Plan ways to enjoy recreational activities and travel, and know how to plan for your future. Don't plan later in life when all of a sudden it's a crisis. Plan early. That's advice for all of us. So when we go back to healthcare behaviors, we start off with primary healthcare. And I put this up and some of you are going to say, well, now everybody knows that. But you need a primary healthcare provider, which is someone in family practice, an internist, or in some cases a woman's health provider will function in that capacity. And you say, why do you have to put that up there? We all know that. Well, in fact, not everybody does know that. And I know that because when I ask that question in my practice and at Can Do MS, I'll ask people, do you have a primary health care provider? And their answer is going to be, yes, it's you, or it's my neurologist. And your neurologist is not a primary health care provider. They don't serve in that role because that's not what their expertise is, and that's not where their comfort level is. So you will need to find one of those other kinds of physicians or nurse practitioners or PAs to be that for you. And you also need to look at how much are you attending to. I will also ask people, have you been doing your usual health checkups? Have you had breast exams, pap smears, prostate exams? Have you had your heart listened to or your blood drawn? If you're over a certain age, have you had a colonoscopy? You know, all those kinds of things that are part of taking care of our health. Sometimes in the face of a chronic disease, people just kind of get all hung up on the chronic disease side because it takes so much time and effort, and they just don't ever bother to get all the other things done. And I've had people say it's been 5 years since I've had a breast exam, or it's been 10 years since I've seen my primary doctor. So there is one source that I can give you, which is the nationalmssociety.org, and they have on their website a whole list of all the preventative care recommendations. So you can go there, you can download and take that with you next time you go into your primary care physician, and make sure that you're up to date with the things that you need to be up to date on. Now, exercise. Haven't we all said over time that we all need to exercise? You know, people say, oh, I'm going to exercise starting next week. I'm going to exercise to lose weight. I'm going to, as my New Year's resolution, I'm going to exercise. But what does that really mean? And what I want to say is that exercise in the face of MS is not just casual anymore. It is something that you should take seriously and really look at as something you need to do for yourself for several reasons. One is exercise is beneficial for helping to prevent osteoporosis. And this is something you see more of when you have MS, and so exercise is good for that. It can help with things like balance issues. It can help strengthen if you're having problems with weakness. There's growing evidence that exercise may in fact have some neuroregeneration capability. And also there's evidence that it can increase your cognitive reserve. In other words, it can help with that wiring that is involved with your thinking skills. So there are lots of reasons to take up exercise besides just the fact that it's good for you anyway. But it is good for you if you have MS. We would like for you to learn to eat nutritiously. And for lots of reasons there, too. One, it can certainly help improve energy. So if you have fatigue, it's going to help with that. It can help you manage weight, keep you from getting to be too thin, which is equally as bad for you as being too heavy. So learning to keep your weight at a sort of level space is good for you, and you can do that through eating nutritiously. And eating all the nutrients needed for your body helps support all your body's symptoms. Excuse me. So that is something that you want to be thinking about as well. Things like milk is part of a general dietary requirement, and because of that osteoporosis issue, you certainly, if you can, take in milk products. That's something that you want to be doing. The next one says, stop smoking, don't start smoking, or encourage your family members not to smoke. And again, this is not just one of those don't smoke campaigns. This is, in fact, something very important for MS. People who have MS and who are smokers are more likely to become secondary progressive more quickly. So if you have relapsing remitting MS and you're a smoker, I might suggest that's a really good reason to stop smoking. If you are in a family and you have MS, you have parents, you have siblings, or your children who don't have MS, you want to encourage them not to smoke, because family members who smoke and are first-degree relatives of someone with MS are more likely to develop MS themselves. So that's a piece of information you may want to pass on. And just in general, don't start smoking. If you have MS, don't start smoking, because it's not good for you in general. So that is a general non-smoking advertisement right there. Limit the use of alcohol. You know, too much alcohol for any of us is definitely not a good thing. If you have balance issues, it's a safety issue if you drink alcohol. If you have mood issues, alcohol can act as a depressant. And so if you're depressed and you drink, you may become more depressed. And so we want to make sure that you're trying to limit that if you do take alcohol from time to time. We would also like for you to avoid the use of illicit drugs. I mean, there's nothing about them that I can say that would be healthy for you, and it certainly could interfere with your cognition, with your safety again, and in general with your health. So other health recommendations are to wear seatbelts, to wear helmets when appropriate. Jimmy Huga, who is the gentleman who actually started the Huga Center, which then went on to become Can Do MS, that we're bringing you this program with the MS Society. He was an Olympic skier in the 60s, and of course in those days skiers didn't wear helmets. And in these days they do wear helmets, or they're encouraged to wear helmets. And Jimmy skied up until his death a couple years ago and progressed until he was sitting in a sit ski. And even when he was sitting in his sit ski going down the mountain, he was wearing his helmet. And I would just suggest to you that you wear helmets as well. You already have some disease going on in your central nervous system, and if you were to bump your head in doing whatever, bicycling or skiing or skateboarding or whatever, then if you're not wearing a helmet, you stand a chance of sustaining a head injury, which is only going to complicate the damage that's already going on in your head. We would also want you to wear appropriate clothing for the task that you're doing. So if it's hot, don't overdress. If it's on the cool side, don't underdress. If you're going to be exposed to the sun, make sure that you wear clothing that covers you so that you don't become sunburned. The next one talks about seeing a dentist regularly. This seems to get put at the end of everybody's list, and for a couple reasons. You have so many things going on that it's hard to fit everything in, and sometimes the dentist isn't the one that gets to the top of the list. And the second thing is that if you have any disabilities, and especially if you're in a wheelchair, there are many dentist offices that are not set up to take somebody with disability and allow you to transfer into the dentist chair. So if that's a problem for you, you call ahead and find out if that dentist is, if his office is set for disabilities. And call the MS Society. They might be able to tell you who in your community might be set up for disabilities. Avoiding excessive sun exposure without effective sunscreen. You know, again, you have a body attached to that MS, and you're just as much at risk of getting skin cancer as anyone else, and we would like that not to happen. And then finally, to get enough sleep. The literature is increasing, talking about the evidence that we're amassing of sleep issues in the general population. This is becoming a big issue in our world. And in MS, it's also becoming a big issue for MS issues as well. And so there are MS symptoms that can interfere with sleep in addition to the disease itself. And those would be things like spasticity or spasms, bladder problems, poor sleep habits, people who are tired and take 2-hour naps in the afternoon, then have trouble going to sleep at night. So there are many things that can interfere with sleep. And when you don't get enough sleep, you're tired, but also other systems do not work as efficiently in your body. Okay, so the social network. Sorry about these slides, folks. Let me go back. You don't have to deal with having MS alone. I too often, unfortunately, hear of people who have, for various reasons, sort of become alone when they have MS. And in some cases, they feel as if their friends have left them. In other cases, they feel as if maybe they have driven friends away. There are many issues that go into this, but you don't have to deal with MS alone. Isolation is one of the primary reasons that people with MS can become ill beyond their MS, because nobody's looking out for them. You know, how many times have you said to a friend, boy, you know, you're not looking so good, your color's not good, or what's that spot on your face, or, you know, whatever. We're looking out for each other because that's what we do as fellow humans. And if you're pretty isolated, nobody's looking out for you. And that's one of the reasons why people may become sicker before they realize that they're sick, because people aren't really looking out for them. The more that people are involved in your life, the more effective you will be in managing the emotional and physical effects of your illness. So having that crowd around you is very beneficial for dealing with your illness and your general health. The more people you have in your life, the less dependent you will be on one person to meet all your needs. So for all the care providers in this call tonight, I'm sure you can agree with that if you are the one person that gets turned to all the time, that really can zap a lot of energy from you. And so you need to have more people in your life so that you can kind of spread things out a bit. And the support of friends and family can have a huge impact on your quality of life with MS. And we talked about that early on, that friends and family bear a lot of responsibility for your self-efficacy and also for your quality of life. Now, nobody should have to live in a world where it's all work and no play. And so we have to look at leisure activities, because these are so much an important part of your general quality of life. And, you know, I'll hear some people probably saying out there, I don't have time for leisure activities. But leisure activities do more than, you know, just take up time to have fun. They allow you to express yourself in so many directions. So they're mind expanding and besides being fun. And sharing leisure activities with friends and family, you know, it gives you something that you're working together on. And so it gives you a point of communication. And oftentimes those leisure activities can do worlds to improve communication and strengthen relationships. And many couples have said when they have engaged then in some leisure activities together, in addition to the ones that you like to do by yourself, but when you engage in activities together, that relationship grows because of that engagement. And almost any activity can be adapted or reconstructed. So you shouldn't be held back by, well, I used to do this. Maybe you can't do things exactly the same way, or maybe not at all. But there are many things that you can adapt or you can relook at so that you can get enjoyment out of it. You have to think about also, outside your own box, doing for others. Having MS or being on disability doesn't mean your life is over. You need to keep busy. You need to keep going. You need to expand your parameters. And our country thrives on its volunteers, and many people have so many needs, and you just might be that person that can help fill those needs. So think about volunteering and think about what kinds of things you can give to other people. You can volunteer at schools, at libraries, teach people English. You can read for those people who can't read or write for those who can't write. You can sit with the elderly and keep them company. And you can share what skills you have with those who want to learn those skills. And if you can successfully do some of those things, it's going to bring a large amount of value and meaning to your life. And I would encourage you to think about what can you do. Also, I want you to look inside yourself. What are your strengths now? Not what were your strengths, but what are your strengths now, and are you using them? Or are you letting them just sit there? Do you have that spiritual belief system, and are you using it to help smooth out those bumps? and allow you to maintain your good health? Or are you getting all caught up in the bumps and good health kind of goes out the window? Have you examined your coping skills, the ones you already have? You know, most of us go through some stuff in life, and we learn how to cope. And those coping skills may well work for you now. And if they do, use them, because you've already polished them and you've got them there for you to use. Are you allowing for personal time? And have you set up an MS-free zone, which is a term that Rosalind Kalb, who works for National MS Society, has made. And an MS-free zone are those times and places where MS is just not even in the picture. And whether it's driving the country in a summer's evening, or whether it's playing Trivial Pursuit with your kids, or whatever it may be, but a time when you're not talking about MS, thinking about MS, and neither is anyone else. And so that's something I want you all to think about, is looking at those MS-free zones. Now, I mentioned early on the topic of, I'm sorry, I got ahead of myself there. For your self-care and reflection, you have to kind of look inside, and you have to refuel. If you've gotten kind of dry, you need to refuel. And some of the questions I got earlier were people who were pretty dry. And so you need to think, what do I need to fill up the tank? Reflect. Reflect on yourself, reflect on your life, reflect on what you want to do. And then activate yourself so that you can move forward. Look at that self-efficacy always, and let yourself get some control over part of your MS, but certainly over your health in general. And give yourself permission to be who you want to be. Who is that person? If you've done some self-reflection, you know. If MS or your thoughts about it aren't permitting you to do this, then talk to somebody who is doing well and is successful in doing that, and ask them how they did that. What kinds of things did they do? Seek counseling if you need to. Become active in seeking that wannabe in you. So whatever it is you think you want to be, take some time actively to find out what that is and how you're going to get there. And then I had mentioned earlier the concept of hope. And MS certainly produces uncertainty, and in the face of uncertainty, it's really hard to be hopeful, isn't it? You don't know what the future holds, and how can you possibly hope for anything when you don't know what's ahead? And uncertainty can occur just not only at the time of diagnosis, but any time throughout the MS experience, because things happen along the way, and then you go, I just can't see. And seeing into the future beyond uncertainty is really, really difficult. And I acknowledge that with you. It's not impossible, but it is difficult. And then developing coping skills, or else using those that you have, will help you perhaps to get beyond that difficulty and that uncertainty. It's not going to take it away, but it will help you to get beyond it. So take care of yourself and your health and your relationships, and all of that is going to help you to move forward and away from that uncertainty. And beyond that lies hope. And we can't ever get rid of the uncertainty, but you can recognize it for what it is. You can experience the uncertainty and say, yeah, this is really scary. I don't know what the future holds, but I can do this. And by doing that, then you lessen the impact of that uncertainty on your life and allows for more hope in the future. So what I would say to you at this time is, MS does not take away who you are. Behold the turtle. He makes progress only when he sticks his neck out. And so with that, I will end this part of the program. And Maureen, are there questions for me?
There are a couple great questions, but first, thanks, Pat. That was a fabulous presentation.
Thank you.
I just wanted to start with a comment before we get to the questions, and it was when you were on your very first slide that says MS is not the whole of you, and someone just made the point that this is also a concern when you tell other people that you have MS, that you don't want them to only see the MS.
You know, that is such a good comment, because I think that that's what people living with MS fear, which is why they sometimes don't share that they have MS with other people, because they're afraid people are going to look at them and only see MS. And I think that probably does happen. But I guess the way to try to work with that is to serve by example and show these people that even though you have MS, you are still the same person you were, and use education, get information if that's what they need, take them to a meeting and have them learn more, whatever. But I think you show by example, and that's how you get beyond that.
That's great. And the next question comes when you were talking about healthy behaviors. And this person lives with a smoker, so they were curious if that would kind of work against them with the progression of their MS.
You know, I've had that question before, and I don't think we have a scientific answer for that, but I'm going to give you a logical answer for that. We don't know that secondhand smoke is going to have that effect on your MS, but it only makes sense that it might. And so I would just share that might with you, and then you have that conversation with the person that you live with.
Great. And the next question, we had two that were pretty similar, so I'll just ask them at the same time. And one's talking about the difficulty engaging in social activities due to difficulty getting around, or insecurities maybe because of bladder issues and things like that, if you have any suggestions.
Okay, well, I will divide that actually into two because I think I'll have to address it differently. If you're having difficulty getting around, I think I'm going to make a couple of suggestions. First of all, you need to figure out why is it difficult to get around. Is it that walking is difficult, or is it because you're in a wheelchair, or is it because you fall, or you have stairs, or whatever? And then once you've figured out why you have the difficulty, then begin to address how you can surmount this difficulty. If it's you're having trouble walking because a cane isn't adequate and you really need a walker, well, maybe that's an answer. If you have stairs, have a PT work with you on how you can do stairs more safely. If you're in a wheelchair, what will it take for you to be able to get out of the house in your wheelchair into some sort of a vehicle, or get to wherever it is you're trying to go with your wheelchair? What's available in your community? What kind of transportation? There really are solutions for most problems, and it sometimes feels like, oh, it's just so much work, and I know it is. But if you can take some of that self-reflection time and look at what you want to be, and in order to be what you want to be, you have to get out to do it, then it's worth putting that effort in, and that's what I would suggest. Then the other side is, if you do have bladder issues, yeah, that is embarrassing, isn't it? And I would also share, though, as embarrassing as that is, that most of the time bladder issues can be managed. But you have to work with your care provider to figure out what is going to be the solution for your bladder issues. And, I don't know what your bladder issues are, but, if it's leakage or frequency or whatever it can be, there usually, honestly, is a solution to that. And so whether it's your primary care who works with you on that, or whether it's your neurologist, or whether you need to see a urologist. But if you take care of the bladder issues, then the socialization will follow. So I would encourage you to do that.
Great, Pat. And kind of along the same lines, someone else has a question about dealing with the fatigue when you're trying to socialize and get out.
Well, fatigue is a bugger, isn't it? It really can, cut short your nights and do all of that. Well, let me kind of give you my view on fatigue and how you learn to manage that. First of all, it isn't that you learn to manage your fatigue so much as you learn to conserve your energy. which is a more positive way of looking at it. If you continue to run through your day and get fatigued, there's no way that you're going to be able to fix that. What you can do is you can learn not to get so fatigued. I always use the example of if I were to give each of you on this call a quarter of energy, you have that 25 cents to spend today on your whatever you're doing. And so it takes a nickel to go to the store, and it takes a dime to do this, and it takes a penny to do that. And if you spent all your 25 cents and it's 2 in the afternoon and you want to go to book club tonight, there's nothing left to go to book club. So my suggestion is that you begin to look at the big picture, your day. And what are you going to do? What do you need to do? What do you want to do? And then allow enough of your quarter to allow you to do the part you want to do, not just the part you have to do. And so that's how you learn to manage the energy stores that you have. And, it could be sometimes when I'm talking about sex, I talk about this, that, if you spend it all before 5 o'clock, there's not much left. And so sometimes it's worth it just to save that whole 25 cents to go do something you really want to do. So just think about that and see if you can't let that help you become more social and increase your social contact.
Great answer. Thanks, Pat. And this last question is kind of a good wrap-up for the presentation. How can we best balance our need for self-efficacy and our realistic perception of the limitations that come with MS?
Boy, that's a deep question. I think through practice and experience, there is reality with MS, no question about it, and you're not going to be able to surmount every problem that occurs as a result of your MS. So I think what you probably are best off doing is pick the things that you can succeed at and do that. Succeed and have some control and feel that self-efficacy for those things that you can control. And then come to grips with the part that you can't control. And I can name you many people who have been able to do that. It wasn't an easy journey, but they were able to kind of recognize that, well, that's probably not going to be in my future, but this can be. And they were able to make that switch. So I know it can happen. It's just that it's not easy. But I think if you work at it and you really want to do this, I think you can. So I wish you good luck with that.
Great. And do you have any last closing words, Pat?
Well, I think what I have to say to you is take care of all of you, and it will take care of you in return. And that may sound a little too easy for the situation, but it isn't. Because I think if you let yourself slip from that healthy line, that continuum, if you slip too far, it's going to be harder and harder to get back to it. And so try to maintain your health as best as you can so that you can, again, continue to function at your highest possible level.
Wow, great. Thanks so much, Pat. That was a fabulous presentation. I also want to thank all of the participants who joined us tonight for this webinar. The next Live Fully, Live Well webinar is on July 21st at 7 p.m. and 9 p.m. Eastern Time. The topic is Maximize Mobility, Achieve Independence with Mandy Rohrig, a physical therapist and CanDo MS program consultant. And you can register for this webinar on our website, which is mscando.org. As soon as this presentation is over, you will see a survey appear on your computer screen. So please take a moment to complete the survey and help us continue to improve our webinars. And we value your feedback and input. And thanks again. This program is made possible by MS Active Source, which is sponsored by Biogen, IDEC, and Elon Pharmaceuticals. Thanks.